What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today, I am going to touch upon a topic that I find a lot of patients recently have questions about, and that is the connection between testosterone and sleep apnea. Is there even a connection? If so, what, why, how, all of the questions that come to mind when we hear about this. So as I mentioned earlier, lately, this connection between testosterone levels and sleep apnea has garnered a lot of attention in this realm of health and wellness, being able to focus on your sleep quality. And it's important to understand how these two factors intertwine. And this can help gain valuable insights into optimizing not only your hormonal balance, but also the quality of sleep. Now, if you're a woman that has tuned in, a female that has tuned in, and you're going, this isn't for me, I would say, hold up. It impacts women just as much as it does men. And you could also impact the lives of the men in your life. So I would encourage you to stay and listen in. What I want to dive into today is the intricate relationship between testosterone and sleep apnea. Explore the impact of sleep disorders on hormone levels, and also what could the potential influence be of testosterone therapy on sleep apnea. So we want to look at some of the latest research, talk about practical strategies for managing both conditions, your sleep apnea as well as your hormone levels, and just empower you with the knowledge to be able to enhance your well-being. So let's dive into the basics first, right? Because these are two very distinct yet interconnected aspects of human health. What is testosterone? It is a hormone. This is primarily produced in males in the testes, and then in females, it is produced in much smaller amounts, but it is produced, and it is in the ovaries as well as the adrenal glands in females. It plays a very important role in the development and the maintenance of the male reproductive tissues as well as secondary sexual characteristics. But again, it's important to remember and note that testosterone is also present in the female body. Yes, in much lower levels, but it is present. And then the question arises, why? What does it do? Well, it serves various functions beyond just its role in sexual development. It contributes to muscle health, bone health. It helps regulate mood, cognition, energy levels, libido, and it plays a part in red blood cell production. Additionally, it also plays a very vital role in maintaining our overall well-being as well as the quality of life. Now, the production and regulation of testosterone is controlled by a complex feedback loop. Bear with me as I nerd out into this, getting into some of the details. Those that are healthcare providers that are listening in, I know I always appreciate the details when I'm learning something or trying to connect the dots. And I'm hopeful, I'm hoping you're going to appreciate this as well. But as I was saying, this production and regulation is controlled by a very complex feedback loop, which involves the hypothalamus, the pituitary, as well as the testes. The hypothalamus releases a hormone called the gonadotropin releasing hormone, GnRH. This stimulates the pituitary gland to produce luteinizing hormone, LH, as well as follicle stimulating hormone, FSH. Does this come to mind? Anatomy, physiology? And LH, the luteinizing hormone, in turn stimulates the testes to produce testosterone. Now, testosterone levels can fluctuate throughout the day. The highest levels typically occur early morning during REM sleep, and then as we go through the day, it starts to dip. Various factors such as your age, stress levels, your diet, exercise, and just overall health can influence testosterone production as well as regulation. Understanding these basics and the role that it plays in the body provides a foundation for us to understand and explore its connection to sleep apnea. The role that testosterone plays in the body is way beyond just its association with reproductive health, right? We got to understand the various functions and its benefits so we can tie it into sleep apnea. One of the key functions of testosterone is its role in promoting muscle growth and strength. It helps to stimulate protein synthesis. This aids in the development as well as maintenance of muscle mass. And it also supports bone density by enhancing the production of mineralized bone tissue, making it more dense, thus reducing the risk of osteoporosis and fractures. Women, this is where we got to sit up and pay attention to. It is also closely linked to sexual desire, libido, and it plays a vital role in maintaining sexual function in men as well as in women. Adequate levels of testosterone are needed for a healthy sex drive, for the ability to achieve and maintain erections in men, and overall sexual satisfaction. It also has a significant impact on our mood and cognitive function. It contributes to overall mental well-being. And adequate levels of testosterone are shown to help with improved mood, to increase motivation, better memory, enhanced cognitive function. Believe it or not, it plays a role in regulating your energy levels as well, in combating fatigue, overall vitality, your increased sense of energy, improved stamina, all of this, where it helps you feel less tired, gives you more energy. So if you have low testosterone levels, you could be looking at fatigue, decreased energy, and just a generalized feeling of the blahs, as we call them at our home. It also helps in production of red blood cells in the bone marrow. And now we know that these red blood cells are responsible for carrying oxygen throughout the body. So it supports red blood cell production, adequate oxygenation of your tissues and organs. So basically, we know that it's crucial for overall well-being and quality of life. It impacts not only your physical well-being, but your mental and emotional health, gives you that sense of vitality and just overall satisfaction with life. So we need to make sure we understand that this multifaceted role of testosterone in the body is important for overall health functioning. I now want to touch briefly upon sleep apnea. For those that are new to our show, go back. We have many episodes on what sleep apnea is, how we can help manage it in adults as well as children. But today we're focusing on sleep apnea, its impact on testosterone levels, and the potential influence of testosterone therapy on sleep apnea management. As always, make sure you're working with an MD. Talk to your doctor about questions you may have. If any particular modality is worth looking into for you personally. Each person is different. Please work with your physicians, have conversations with them, and always follow medical advice. So understanding sleep apnea, it is a common disorder. It's a sleep disorder. This is when a person stops breathing for 10 seconds or longer multiple times throughout the night. These pauses in breathing, they're known as apneas. And like I said, they can happen many times throughout the night. It has to last for 10 seconds to be classified as an apnea, but sometimes it can last for minutes. And because of this decrease in oxygenation, the oxygen deficits that happen, it impacts the quality of sleep. It impacts our overall well-being. Happens when the muscles in the back of our throat kind of fail to keep that airway open. The muscles relax. It blocks the airway, causes either a complete obstruction or a partial obstruction. And in this case, this disruption in breathing can actually trigger the brain to briefly wake up from sleep, what we call microarousals, just to make sure that normal breathing is restored. And this then, we know, over the course of the night results in fragmented sleep and poor quality of sleep. There are three main types of sleep apnea: obstructive sleep apnea, which is what is the most common form, and it's also what we discuss most commonly on this show. Then you also have central sleep apnea. This is less common, thankfully, and it is caused by a failure of the brain to send the right signals to the respiratory centers in the brain. And then the third time is what's known as complex or mixed sleep apnea. It's a combination of both adult obstructive as well as central sleep apnea. Common signs and symptoms, especially in adults, is snoring, right? The most common sign, loud, disruptive snoring. Choking or gasping during sleep is another big one. Waking up to use the bathroom multiple times throughout the night. If you have morning headaches, if you're constantly tired during the day, have a hard time focusing, have a hard time remembering things, mood changes, decreased libido, sexual dysfunction, all of these are your most common signs and symptoms of sleep apnea. And it does put you at a higher risk for cardiovascular issues, for hypertension. You're at a greater likelihood for developing type 2 diabetes. Because of the disruption in leptin and ghrelin, your hunger and satiety hormones, it could lead to weight gain, also metabolic disturbances, poor concentration, impaired cognitive function. And then if you're one that has excessive daytime sleepiness, you're at a greater risk for accidents. If you tend to fall asleep at the wheel, please, please, please seek help if you do notice this in yourself or in a loved one. Now, the reason we're here, the connection between testosterone and sleep apnea, is there one? And how are they interconnected? This connection is complex and it is a bi-directional relationship. Let's make sure we understand that. Sleep apnea can impact our hormone levels, also our testosterone levels, and in turn, low testosterone levels can influence the severity as well as the management of sleep apnea. So docs, listen up. The repeated interruptions in breathing and the resulting fragmented sleep can disrupt hormone regulation. We've talked about this over and over on previous episodes of the show. This can lead to lower testosterone levels. Studies have shown that men with untreated sleep apnea often have lower levels of total testosterone as well as free testosterone. This can now contribute to symptoms such as reduced libido, decreased muscle mass, and fatigue. Furthermore, sleep apnea is associated with higher levels of cortisol, which is our stress hormone. This stress hormone can further suppress testosterone production. And this chronic stress, because it's not just it's a one night and I'm done. This is ongoing. This chronic stress on the body, which is caused by sleep apnea, can disrupt the very delicate balance of hormones, leads to hormonal imbalances and potential long-term health consequences. Can testosterone therapy influence sleep apnea? So testosterone therapy is also known as TRT, testosterone replacement therapy. This is a treatment option for individuals with low levels. Now, while the primary goal is to restore these levels to a healthy range, it has been shown that it can positively impact your sleep apnea. Research has shown that testosterone therapy can help improve sleep apnea symptoms in some people. It can potentially contribute to the reduction of severity by improving upper airway muscle function. It can increase your respiratory drive and decrease the deposits of fat around the throat. This can contribute to airway obstruction. It's also important to note that the use of testosterone therapy on sleep apnea treatment is still being studied, and its effectiveness is going to vary depending on individual factors. Every person is different. Also on the underlying cause of sleep apnea, also on what your overall health looks like. So there is no magic one, but this could be one piece of the puzzle. So as I mentioned earlier, it's very, very essential to make sure you're consulting with your healthcare provider who is experienced in hormone therapy. And if it's something they aren't, they can find you somebody that will be able to give you the answers as to, is this even the appropriate course of treatment for your particular needs? Ongoing research is still continuing to explore this relationship, and they are looking into the impact of sleep apnea on testosterone levels in different populations. They're exploring the effectiveness of this therapy as a treatment option and also other potential interventions to address this interplay between the two factors. So I will keep you informed on latest research developments as they come across my way, as I continue to look into it and understanding this evolving connection between testosterone and sleep apnea. How are we going to manage our sleep apnea? Remember, managing your testosterone levels, you got to work with your MD, but there are various strategies that we can take to improve our symptoms as well as optimize the testosterone levels. Weight management. Huge one. Maintaining that healthy weight is going to help you reduce that severity of sleep apnea. Losing excessive weight through balanced diet, regular exercise. We know it's been shown to alleviate some of those symptoms of sleep apnea, but also positively impact hormonal balance. Remember, these are all adjunctive therapies. These are all lifestyle changes. This is not a treatment modality, but it does work in compounding the effects of your treatment modalities. Sleep hygiene. Good sleep hygiene habits are going to help you get better quality of sleep. Getting into a regular sleep schedule, creating that comfortable sleep environment, avoiding stimulants such as caffeine, electronic devices before bedtime, limiting the use of alcohol right before bed. All of this is going to help improve your symptoms. Positional therapy, again, sleeping on your side rather than your back, can help reduce airway blockage. It can help improve breathing during sleep. And then stress reduction, right? Using treatment options, modalities such as meditation, yoga, breathing exercises, relaxation exercises. All of this is going to help reduce the impact of stress, because we know that high stress levels can contribute to hormone imbalances, make your sleep apnea symptoms worse. Some of the treatment options: CPAP. CPAP is the gold standard for treating your obstructive sleep apnea, or even your central sleep apnea. You wear the mask, delivers that constant flow of air, keeps your airway open. We know that a lot of patients are unable to use it, which is why oral appliances are a great option for those patients with mild to moderate sleep apnea, or for those with severe sleep apnea that cannot tolerate their CPAP. It helps reposition the jaw, prevents the tongue and the jaw from falling back into the throat when you're asleep, and just keeps that airway open during sleep. And then in cases where your testosterone levels are significantly low, hormone replacement therapy can be considered if your providers, your MDs, think that is a good option for you. It can help restore that hormone balance and alleviate symptoms that may be associated with low levels. So by implementing a combination of lifestyle changes, medical treatments, therapies, it is possible for individuals to effectively manage their sleep apnea, support their hormones, have regulated hormone levels, and just lead to overall well-being of life, improved quality of life. As always, it's essential to consult with your healthcare professionals that may be specialized in sleep medicine, have extensive training, your dentist, your ENTs, your sleep MDs, or even your endocrinologists who may specialize in hormonal health to help determine what is the most appropriate treatment plan for managing your sleep apnea as well as optimizing testosterone levels. As always, it has been a pleasure sharing this information with you. If you know somebody that could benefit from this, please share this episode with them. Rate the podcast. Leave us a review. I adore reading the reviews you guys leave, and it really helps me structure the show as to what it is that you are looking for more of. I will see you next time.